When most Nigerians hear the word health, what comes to their mind first is hospital, white lab coats, stethoscopes, prescription slips. However, as I've grown deeper into public health, I've realized that our health is much more than hospitals. In fact, for an average Nigerian, our health is already under attack before we step our foot into a clinic. A few years ago, my friend's mother fainted while cooking and she was rushed to the hospital. While at the hospital, the nurses were quick to point something out to us that she was battling a lot of stress. Well, she had not eaten well in days. She was thinking about debt collectors and all of these issues. And she couldn't even sleep well at night due to generator noises all around the environment. And all of this contributed to her poor health. So that day, I saw with my own eyes that health is not only about treating our symptoms, it is majorly what we eat, how we live, what our stress coping mechanisms, and all of that. So this draws us to the big question: what exactly is affecting Nigerians' health? Public health experts call these things social determinants of health. According to the World Health Organization, these social determinants of health are the condition where we are born, we grow, we work, we live, and we age. And these have much more impact to our health than we realize. Many Nigerians are living paycheck to paycheck. Even those with jobs sometimes go months without pay. So how can someone live a healthy life in that situation? And of course, we have figures to back it up because according to the National Bureau of Statistics in the year 2022, 63% of persons living within Nigeria are multidimensionally poor. This means they do not have access to good food, good shelter, water, they lack access to education, stable income. And we see this every day in the streets, in the market, at school. You look at people's eyes, you see the stress. It is deadly and it is a silent killer. Should we even talk about the environmental conditions? We have open gutters everywhere, the air is polluted, we have generator fumes coming from every neighbor's compound every night. Some homes are overcrowded with no proper ventilation. Scarcity of water also even make people to drink water from questionable sources. And the worst part of it is that we treat malaria without combating what is causing this malaria. And this is why many illnesses will continue in Nigeria because we don't even know what causes them. And even when we know, there are not enough resources to tackle and combat them. And this is where we need to actually act right. How do we do this? We need to actually be aware of what is actually affecting our health. If you realize what these issues are, you can start small. You can keep your space clean, get rest when you can. And if you can, try to eat healthy. I know it might be expensive eating healthy these days compared to the fast, unhealthy method or option. But then the little things are what matters actually. When you have a trash, don't just throw it into the gutters. You can just keep it until you get to a dustbin, because when you throw those trash into the gutters, instead for the gutters to be flowing freely, those trash are going to block the passage, and when they are blocked, it causes stagnant water, and when there's stagnant water, that's when mosquitoes come and breed, and in return, you get what? Malaria. So whatever you sow, you're actually reaping it. That's why you need to start small and do what is right. Because honestly, nobody's coming to save anybody at this point. So we just need to do what is right, start small, and just build upon those habits. So remember, health is not just about hospitals, it's about these little things. So one day at a time, one habit at a time, we get there and you stay healthy.